Okay, well, Judy Lyles, I know you've been working with the VA with light therapy or photobiomodulation with the VA in Florida for quite a while, and you've got some real stories. So take it away. Tell us about it.
Well, I started this adventure when I came up to see Hannah Kroger's uh, school for light therapy. I had done some extra work at the VA hospital. If you get certified in special different, nursing things, they give you grants and they give you bonuses. And I got enough bonus to buy the light. So I was very excited about coming up there, learning how to do light therapy. And I had the good fortune of Light Up to Live was happening in Dallas at that time. And we flew to Dallas. And I met some wives of the veterans that were reaping the benefits of light therapy for their husbands, with amputations, with traumatic brain injuries, with all kinds of wonderful things, giving them more energy. They were um, engaging with their children, and these wives kind of cornered me and said, you need to get this in the VA hospital. And this one lady said, promise me. And I said, of course. Like, I didn't, I just said, yes, I'll try. And we were working on videos or PowerPoints to present to other people, and we had just learned that. So I went home to the VA hospital and I had this fantastic PowerPoint on neurology and light therapy and what everything was going on. And I presented it to them on a very, very busy day. And the video didn't work, and I couldn't get the lights to work, and I couldn't get the pads to work. And one of the doctors was having a fight with his secretary, and it kind of just crashed. And I looked at my mentor, and I was crying my eyes out. I said, I've destroyed this. I'm never going to be able to get this in the VA hospital. And so I put my head down, took my toys, and left. And I thought, forget it. This is too hard, and they don't believe me, and they're not interested. So I went back to my office, and the next day, one of the doctors that I work with, who is very open-minded and a wonderful woman, Dr. Kadiala, um, she came in and was complaining about neck pain. And I said, Dr. Kadiala, what's going on? And she said, she had had some surgeries and she was having severe neck pain. I said, you should come over to my house. I got these beautiful lights. I just took this class. All this good stuff's happening. And she said, of course. So she came over and I did light therapy on her neck. And for 2 weeks, she had no pain and was really a lot more mobile than she was before. And we had patient after patient after patient in this clinic with diabetes that had neuropathy of the feet and hands, and just really, really hardships that high sugars have caused them. And especially the neuropathy, almost every single patient came in concerned about that. And they weren't urinating well. They were, their diabetes, their sugars were high. They weren't feeling well. They were depressed about the chronic pain. And if you have pain for a long period of time, it does make you depressed. And so light therapy,
Absolutely.
yeah, light therapy just seemed to be the ticket to me. And she looked at me and she said, this is fantastic. I feel better. I'm happier. My neck feels great. Why don't we do this for the 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 people's feet, the diabetics' feet with neuropathy. And I said, that sounds like a great idea. She said, well, put something together. And in our emails, it just had come up that they were presenting grants to people that had innovative ideas. And this was a pretty innovative idea. God bless Senator Kane, who had come in and said that the VA needed to learn different things to do for the veterans for pain. They wanted to get them off of narcotics and into some alternative things. And this was as alternative as it came, I imagine.
Right.
And so it opened the door for me. And she opened the door for me. And as hard as I struggled, you know how God always takes his own time. It was presented to me in my lap. So I applied for the grant and I was given the grant. And we wanted to do a study because we believed that if we did a study, they would take us more seriously. And
Right.
we had, just buku amount of patients that wanted to do this. It was great. And so we started. We bought the lights, and In-Light Wellness wasn't available at some time, and am I even allowed to say In-Light? Is that okay?
Yeah, yeah, yeah.
Um,
Yeah,
so
it's
we had,
in light therapy now, but
yeah,
yes. So
and we had to use some other alternatives, but In-Light came back in, so there was always, like, hiccups and different things that we were trying to do, and we were, like, stopped, and the presentation was difficult. And I had a friend of mine that was a PhD at Shands Teaching Hospital who did lots and lots of studies. And I asked her to come over and kind of help us with this. And she was more than happy. She had just retired. So she showed up. I mean, like anything I needed was given to me, put in my lap,
that's awesome.
handed to me. So
Right.
it was like wonderful. So all these doctors got together and the patients were available to us. And so we started very poorly. We started out, I didn't know what I was doing. Thank God Marcy had helped me a lot. And
Yeah.
I used a lot of her stuff to interview the patients, to do the tests for, mental acuity and everything else in their feet. And they were not real, the doctors I was working with weren't real attuned to what was going on with light therapy. So I could say to them, they need light therapy from their heads to their toes. So
Oh, that's
instead of
awesome.
just only their feet, because I
Right.
wanted them to have the complete benefits of it, which was fabulous because they would come in, a patient would come in to me and we would do the, pregame warm ups. We would, test their feet and test their hands and their grips and their, what their diabetes was doing. They put on monitors. They had just started the Libra monitor on their arm. So we were seeing their glucose every minute. And so we were having lots and lots of data. And they would come in saying, their head hurt, their neck hurt, their back hurt, their feet hurt, their legs hurt, their arm hurt. And I said, you really need to come twice a week for about 16 sessions. And they were more than happy to. And the gentlemen the soldiers that are at the VA are very stoic and they don't complain a lot. And they would say, "Oh, this is fine." And they wouldn't really give me much data. They were not, real helpful with the data part.
I'm not
And
dying, so
yeah, I'm not, yeah, pretty much. You're
I'm
not
not
shooting me.
dying,
I'm
so I'm
good.
good. Right.
Well, they would say things like, I don't need as much gabapentin. And I would go, what? You took yourself off a gabapentin, you didn't even talk to any of what's going on. And they would say like, my feet are feeling better. I went out in the yard and I mowed the lawn. And I would say, you're kidding. And they hadn't said a word for like 3 weeks or 4 weeks. They would look at me and go, I'm I'm like a lot happier than I used to be. And I would say, "Oh, really? That's amazing." And they would say, "I have a pain right here," and they would specifically tell me a certain area where there was an injury to them, where they were in pain everywhere. When you have chronic pain, your frontal lobe says you are in pain everywhere. When
Right.
you are treating that pain, and you're treating also, with light therapy, the frontal lobe, you not only become less depressed, you also become less in pain. The pain lessens a lot. Um,
And
every single one of them would tell me that their urinary stream was better because I always put it on their bladder and their back because everyone has lower
mhm.
back pain if you're over 50, I'm convinced. And of course, the nerves coming off of your spine go right to your legs and stuff. And so I needed to, as you taught me, I needed to take care of that also. And so, over and over and over again, I would have success, little tiny successes with these gentlemen. They would come in and they would say, I don't believe this. I don't know if it's true. And then about 4 weeks later, they would go, I'm never missing a day of this. Can I do it after? Don't stop. Can I come in if I'm hurt? So what started out to be just a sampling project ended up where people were lined like whole the psychiatric group came down as a whole at one time because one of the patients said that their feet were feeling a lot better. And so 10 guys showed up at the clinic and said, we want in, and I was like, oh my God. So yeah, word of mouth is probably your strongest, helper there. And all of them had a lot of success. Some of them, just said, "Well, this isn't for me," and that's fine. They were too anxious or too worried, or didn't believe in it. But most every single person was a believer after about 4 or 5 weeks of it.
Yeah.
So that was fantastic. And we
So,
finished.
s-
Yep. Go
so let
ahead.
me just back you up a little bit. So, your first introduction, like, how did you find out about light therapy or photobiomodulation? Originally, was it from the Light Up to Live tour,
No,
or was
no.
it
It
no?
was I, had worked at, Shands Teaching Hospital in the operating room for about 25 years, and I had danced professionally when I was younger, and so my feet were always hurting me, and I would stand for hours upon hours upon hours with these neurosurgeons. They have very long cases, some of them 18 hours, and, we would just be running around like chickens with our head cut off, of course, in the operating room, and after a while, your feet, they pay the price. Well, I kept complaining, and my girlfriend kept saying to me, "You should go get light therapy." And I said, "I'm a Western medicine girl. I don't believe in that voodoo." And she's like,
Ooh.
Yeah." She said, "I promise you, you won't regret this." So finally, they offered me drugs or surgery or this, that, and the other. And I was like, "I can't take drugs. I'm a nurse. I've got to like take care of patients." And I
Right.
went to Carol, who's a wonderful gal in Gainesville that does light therapy. And I took about, I think she said for $400 I could get 6 sessions. So I went and I did, and it was amazing. And I couldn't believe it. And she was like 83 at that time, and she was bouncing
Yeah.
around like a little chicken with her head cut
And
off. And I was
gorgeous.
and gorgeous.
Right.
And I was like, "Where did you learn this from? How do I get this? Where?" I was like so interested. And she's also a nurse, so we bonded that way too. So that was the person that inspired me to go, and the feet feeling better. So of course I went into neuropathy of the feet. That helped. I knew it helped me, so I knew it would help them, the veterans, and they were so good. They were wonderful. And
And so then you came out to Boulder to our
right,
course, to the Let's
right,
course. So for the listening audience, Let's stands for Light Energy Training Seminars. And so you came out and you did all 3 levels of
right.
our training.
The
And
first
I
level. Yeah, I
go ahead.
came back home and worked on, my family, my friends, and, many, many veterans. My, nephew had traumatic brain injury. Many of his friends had a lot of injuries, so I worked on a lot of vets before I even worked on the veterans at the VA, and this was probably when I was still at Shands. I hadn't gone over to the VA yet, so it took a
Okay.
couple years, and then finally at that final, level 3 with Let's. And we went to Dallas, and that was really the game changer, where I would be presenting it more to a clinical setting than just my home.
Yeah,
So,
so talk about that because now, we're fast forwarding to then you're presenting to doctors and the
right,
hospital staff and all that. So
right.
yeah, so
I think
that
that when you first get into a situation like this, you're kind of stealth because you don't want to be ringing your bell all the time. So, I just thought I would do enough patients where word of mouth would start going, and it did. So, the podiatrist came up and wanted to see what was going on, and they recommended their patients. I went and presented to them. I presented to the PCP doctors, primary care doctors, and the neurosurgeon, I mean, the neurosurgery doctors were already, that's the first one I did and that failed, but a few other ones. And it was real unusual. A couple of the patients came into me, and they were told that their problems with their hearts were inoperable and that they would have to live with this. And they also had
we don't
diabetes.
like that. We
No,
don't like that.
no.
Yeah,
And they
we
also
didn't.
had diabetes and neuropathy of the feet. So I said, "Well, let's put these lights on your heart too. It's up there, right there, your spine, front and back. Let's go." And do your feet and your head and your, like, everything I was doing normally with everybody. And several of them were taking nitro almost every single day, and they didn't have to anymore after that. They were not in need of nitro as much. There was not as many episodes of angina. They felt that their breathing was much better. They felt that they could, zip around the backyard and do a lot of these guys are working in their backyards. They're retired. if
Hmm.
they can't clean up their backyards and then they feel bad. So mowing your lawn is a great, is a great outcome
Right.
with therapy. So
Yeah,
we
absolutely.
had a lot of successes with that. And so,
So just in case this is someone's first time they're listening to any of our podcasts, why would their circulation be better with light therapy?
because the light goes into the mitochondrium, increases circulation, gets rid of the nitric oxide, puts in the oxygen. And for some reason, when the primordial ooze was going around, we have light receptors on our mitochondrium. And when you put the light on them, they receive it and it starts healing sick cells. Not so much well cells, not really, they don't see a lot of difference with well cells, but if your cells are ill or damaged or with age or injury or illness, it seems to gravitate towards those and increase the oxygen in the circulation. And that decreases the pain and increases healing like nobody's business. In fact,
So,
when Dr. Messner over in Hungary first kind of discovered this, he had a very poor laser with a red light on the bottom of it. He was working with pediatric patients. He was trying to cure cancer. And what he did was he had little mice and he'd open their, leg or wound or wherever and put a little cancer in there and sew it back up and put the light on it. And it didn't do anything for the cancer, but it absolutely healed the wounds and grew hair. So he knew that he had something that helped wound healing. And so DARPA got a hold of it, and it was right during the Vietnam War. And they were trying to grow limbs. That's what they were using the light therapy for at that particular time. So light therapy has been around a very long time, 50 years or more.
right. Yeah. Yeah. And
And
so then when you're now the word's getting around the VA that
oh,
something's
yes.
happening with this light therapy. And then you started to present
Yeah,
more formally, right, to the
absolutely.
docs and stuff.
And
So,
there are 14 VA hospitals right now that use light therapy every single day in their pain clinics and their traumatic brain injury and neuro clinics. So it's caught on, and the word is spreading. So that's all we can hope for.
that's awesome. And so do you work with patients with traumatic brain injury or Alzheimer's or any
Inadvertently,
of the cognitive decline? What's that?
inadvertently, like they'll
Yeah.
come in with cognitive decline for sure, and with Alzheimer's, with Parkinson's disease, with traumatic brain injury, absolutely. Almost every patient had two things they were told to me. Number one, they slept better. And when you sleep, you're in parasympathetic and you heal better always. And
Right.
that they can urinate better. Two things that are extremely important with aging and elderly,
Right.
especially the males with prostate problems and everything that we have going that way. So we knew absolutely that those two things were really to the forefront. It was just a byproduct of what I was doing with the neuropathy of the feet. But you know, everyone started paying attention when their patients were coming to them saying, "I'm feeling a lot better." I had a cardiac a heart transplant patient who continually increased his kidney function, got better and better with the lights. And when his 16 weeks were up, his kidney function went down. And he came back to me and he said, I need to come back to do lights again because my kidney function was really doing well with my heart transplant. And so the VA eventually gave all my patients boots, you know,
Right.
and so they
The light therapy pads that are called boot pads, not actually like cowboy boots,
right.
right? Okay.
And they use them all over, of course, because they're nice long
Right.
pads and they're great. And they use them at home everywhere they have pain, and especially their legs and their feet for neuropathy. So it was a win-win. It really was excellent.
Yeah, that's excellent. So are you still using light therapy on a daily basis with your
No,
patients?
no, they had some cutbacks, so we did not get a grant again. And but I do it, I have a home at all the time. I'm have people that come into my own home to do light therapy. But the VA said that they would put it on the back burner and try it again if they get some more grants. But the pain clinic is using lasers, laser light, not pads. So really, I was kind of like way before my time, I guess. They use
Yeah.
yeah. So they're using the laser that you can hold in your hand, and you do it for seconds with infrared and red light, and that helps the people with their pain. So that's how they're using it in our clinics at the VA hospital, which was inspired by what happened with our study. That's why
Yeah.
they're doing it, because the veterans absolutely refused not to have light therapy. They wanted it, and they wrote everybody, and they wrote their congressman, and they said, please bring light therapy back. And so the pain clinic took it over.
Yeah, and I know for us that, just any way that we can get people doing light therapy, it's best if they can have it in their own home,
Right.
because that way they don't have to travel and all that. But the systems can be kind of spendy, depends on, which one you get. And of course, we want to encourage people to get good quality because, you want one that's going to last for a long time and everybody in your family can use it and all of that.
Right.
But light's good for us. And, you're not going home with a laser. You can go to your clinics and get laser treatment. But in the
Right.
home,
You need
for
that.
those of you all who may not know about photobiomodulation or light therapy, there are many, really good systems out there, and we have our preferences, but use what works. I like a pad-based system because I want to get those lights directly on my skin, and that's where, we're finding the most benefit, but I don't know everything. So, so tell us a couple of like stories of
Uh-oh.
that you just remember, with your people.
One of the funniest things that happened to me, I had like I said, they're very stoic. They don't tell me a lot. And one of my patients wheeled in one day, and he said, Miss Judy, I need to tell you something. And he said, I don't want you to think that I'm being forward. And I said, I won't think that you're being forward. What's going on? Tell me the truth. And he said, well, Miss Judy, I haven't had an erection for 10 years. And after I've done your light therapy, everything is working down there. But my wife is awful mad at you, and she wants to talk to you. And I said, okay. I said, okay. And had to apologize to his wife. I said, I'm sorry. That was one of
That's great.
the, yep.
Yeah. And, increase circulation, right? I mean, the natural Viagra, right?
Well, I was wondering why everybody came back every single week, never miss an appointment. I think I started so how they don't tell you everything. They say,
Yeah.
what's your pain level? Oh, it's fine.
Yeah.
So
Yeah,
that's
I mean, I've had, well, I first came to light therapy because I used the face mask on my throat for anti-aging reasons, and it restored my singing voice. So,
yeah,
and not that I was ever a soloist, I wasn't, I'm not, but I like to sing. And the notes would not connect. And one session, and it lasted for 4 days, and then I did it again, and it's, I've been able to sing ever since. So there's all kind of crazy stuff that happens with light therapy
right.
that we didn't know should happen, because I wasn't having pain in my throat. It's just that, well, the pain was an emotional pain that I couldn't sing happy birthday to my children.
Well,
So
a lot of times that that decrease in inflammation causes all kinds of wonderful things to happen. And that's one of
yeah,
the number one things with light therapy. It decreases inflammation.
absolutely.
And,
And
I think it said your lymphatics will start to increase almost 400 times what they normally do. So it's really moving. So you're moving things out. You're, getting rid of fluid that you don't want, and it's fabulous.
so how you would see your patients once or twice a week
Twice a
when
week
you
for
had the
16 sessions, or 16 weeks is what it was. Yeah, it was 16 weeks. And then they would come back constantly. They always
Right,
wanted to get a tune-up. They just fell. They're going on vacation. Their leg hurts,
right.
whatever was going on with them. Some of them pre or and post surgery, they would come and see me. So
Yeah,
there was a
so
lot of
photobiomodulation is notoriously good for wound healing. So have you
right.
seen like with the diabetic ulcers or
Absolutely.
anything like that?
Not so much with ulcers. You have to be very careful with light therapy and stumps, or
Okay.
if they had an amputation of some kind. You can't put the light straight on there. You have to put some kind of pad or something over it so it doesn't affect that very tender and soft skin. Also, the other part of it is that light therapy, it seems to draw, if you have an infection, it'll, cause that infection to move, and you can have some infection on the top of your skin, if it's very tender and just sutured up and all that stuff. With surgeries, when you put light therapy on there, it decreases the pain, it helps the wound healing, and it helps the scars. That's really what it was very helpful for. If someone had a scar of some sort, we would put light therapy on it, and it would decrease the scar, decrease that tightness that you have, the pulling, and make it more supple, the skin more supple. And age spots, it would get rid of age spots. It's good.
Yeah. So
That's good.
how long after, let's say, a surgery for, you know, well, where there's an incision, so would you would
Post-op,
you start using light therapy? How long after?
immediately. Yeah, and I've gone to some of the patients and some of the veterans that were unable to take narcotics because of they had problems with narcotics or whatever medication that they were using for pain. They were not able to use that anymore. That the light therapy would help them pre-op and post-op. Absolutely. And you don't have to put it directly on the wound. You can put it to the side of the incision, and it would help with the pain on the wound. And you can do it for 40 minutes a couple times a day if for pain, as far as the pain was concerned. We did it that way and it worked fine. It worked great. And then they wouldn't
Yeah,
have to use narcotics, so it was very helpful.
which is a huge thing, huge.
Huge.
So,
Absolutely.
go ahead.
A lot of people that were coming off of medications, was very helpful. They felt their head was foggy. They felt very foggy. And after using one of the helmets with the InLight, they felt a lot better. They felt a lot more clear, concise. And so
Yeah.
you can tell that it would really help somebody with Alzheimer's.
So I recently, I have a Inlight helmet or cap, they call it. So for the listening audience, it's a light therapy pad shaped like a helmet. It's not attractive, but I kind of feel like a Munster when I put it on. But anyway, it covers the entire cranium, which is important if we can cover it completely. Without going over the eyes, and it could go over the eyes, but in this case, it doesn't. And there are certain, you know, well, anyway, if you wanted to cover your eyes, you could do that with a face mask. But anyway, so I have my system set up right next to in my couch so that when I'm in the morning planning my day sitting there, I can have my helmet on, my cap on, and the pads, elsewhere on the body. And I'm also a pickleball player, so I like to, stay in shape for being able to play, and that really helps me pre and post
Oh,
playing.
yeah.
But anyway, for whatever the crazy reason, I went for like, I don't know, 4 or 5 weeks and didn't use the cap. I don't even know why. It's just, I got out of the routine or something. I started to
Right.
be so lazy and dull-headed and uninspired and all these things that was just really odd for me. It was odd.
Yeah.
And I'd say a little forgetful, but it was more like foggy-headed. And just no energy. And then, I don't know, I thought, maybe I should do the do the cap. I put it on. The next day, I had a completely different experience of my day. And so I thought, oh God, of all people, why am I not doing this? Why did I take that break? And so now I'm just, and we're all getting some age on us. I don't like to claim it too much, but I noticed that I actually need, not just want, but I actually need to use my cap more frequently. It just keeps me alert and it keeps my brain working better. So,
Absolutely.
and sleeping better, plus the energy level. So, okay, is there anything that
Right.
at the VA or your work or anything that I haven't asked you that you want to talk about before we finish this session? We have lots
Probably
to
a
talk
million things,
about.
and I'll think of it after we stop. Probably a
So,
million
one
things,
of
and I'll
the
think of them all after we stop.
Okay, so, we can do many sessions with you. So you think of the next topic, we'll just do another one. But one of the things that we are going to do for those of you all who are thinking about doing the light therapy certification course, which is how I met Judy, is that she came to our course at Hannah Kroger's retreat up here in Boulder, Colorado. And but when the pandemic happened, then we stopped doing the in-person trainings for obvious reasons because we couldn't all get together and meet. So currently, we only have the level 1, which is the technician level, but you can be board certified at that level. And Judy came and did that. She did level 2, which is more geared to the practitioner, and level 3 is the instructor's training. So she did all 3 levels, but she has agreed to be teaching. So that's one of our next projects, teaching with Marcy the level 2, the practitioners level 2, to put it online with Marcy and me. But I teach the understanding energy part of it and the legal and compliance and all that kind of stuff. And you two are going to teach the whole science of that. So you've agreed to do that.
Scientific.
And that's
Right.
how, people are going to get to see more of you. Red light therapy, of course, it's more than red light therapy now because it's red, infrared, blue, green, all these different wavelengths and colors. But it's becoming so popular that a lot of times people will open clinics because they know it works and they get the equipment, but they don't know how to talk about it. And then when an issue comes up, or some difficult patient or client comes in and they don't know where to go for the information. And so that's really the benefit of doing our course, is to have a place to go and to get more of the science and the understanding of how to work with photobiomodulation and the human beings or the animals. So that's gonna be
Right.
good. That's our next project. But anyway, okay. Well, thank you, Judy. But before we
Thank you.
totally stop, tell us a little bit more about your background, because I didn't even really get you to introduce yourself.
Sure. I'm Judy Lyles. I'm an RN. I've been in nursing for 42 years. I was over at a teaching hospital, Shands Teaching Hospital in Gainesville, Florida. I worked in the intensive care units. I worked in the operating room. I was a floor nurse. I worked in GI. I put people to sleep for colonoscopies and endocrinology, all kinds of good stuff. Anyways, I came over to the VA hospital after I retired from Shands Teaching Hospital and started in GI over there, putting people to sleep. And we used lights there all the time on each other because I'd bring them to work when someone was in pain. And
Right.
I, um, I started running this little clinic, and that's where we got the grant and started using the light pads. So that's me.
And, and so what's your mission? Like, what do you hope to see with all of this?
Oh, absolutely. the breakthroughs that have been probably this year with the London conference were just phenomenal. The breakthroughs with one of the doctors over in Israel was running downstairs. If someone had a heart attack in his ER, he'd run downstairs with the laser, with some red light and infrared, and put it on the heart and increase the circulation and increase the stem cell release so you wouldn't have so much damage on the hearts. Pre and post-op, I don't think that it's even been, I think that light therapy we're just at the beginning of it. There are so many uses for it we don't know yet. And there's so many people working on so many different projects. One of the big things was COVID. People had nothing for COVID, and they were using a lot of red and infrared therapy on people's lungs and the blood going into the body. They were putting infrared and red light on it to help decrease the viral load. And they did some incredible PubMed studies with that. I think the more studies come out, the more we use it, the more we'll need it for sure. Since
Well,
it's
I know
not a drug.
right. And I know in my clinic, I've worked with a lot of post-COVID clients who are
Yes,
just desperate,
too.
desperate. Like,
Absolutely.
they're long COVID, nothing's working. And we're after X amount of sessions, they're expectorating, this all, and I'm like, better out than in, let's get
Right.
that all cleared out. But yeah, and where we're putting pads front and back of the chest,
Right.
etc. And having some real good success. Well, my own brother was in the hospital. I don't know how long with COVID, a long time. I'm thinking it was like a month or so. But
No.
and I'm in Colorado, they're in Louisiana. And at some point, because most of my siblings, for those of you all that don't know, I'm from a huge family. So, but most of my siblings either have the in-light devices, the light therapy devices, or they have access to it. Their kid has a system or whatever. So at one point, I said they were going to move him to long care. I don't know what you call it, but long, where he's
Right.
leaving the hospital and going into extended care, whatever.
Right.
And I said, has anybody brought the light therapy unit over to him? They're like, no, they're not going to let us use it in the hospital.
Oh, sure
I'm
they
like,
will.
oh, for God's sake, just, go do it. So they did. So my sister went over there. He never had to go to the long care. He
Oh,
started feeling
wow.
better that day. That day.
Right.
I
Right.
mean,
Right.
folks,
It
we
loves
got
sick
something
cells.
here.
I mean, if you've got sick cells, it's going to go after them.
Right.
That's the best
We,
part.
and it's not a cure-all, but for God's sake, every living organism needs light to function
Right.
properly.
And
And so
if
it's
nothing else, it
certainly
gets you to relax and to rest and to
right,
heal. And
right,
someone being in an intensive care unit and that, stress of just being ill for a long period of time, you never rest, and you
right,
really need to rest and get into parasympathetic and, you know, just get that frontal lobe relaxed. So
right.
that's really healing, very healing.
Yeah, because that's where we'll heal.
Yeah.
All right. Well, thank you, thank you,
When
thank
lighting.
you. Okay, to be
Welcome.
continued.
Wonderful.
All right.
Thanks for asking me. I appreciate it.
Yeah.
Okay.